here. So hello, and maybe sometime you'll hear from her as well. But I want to introduce you to Caitlin Steen. She's from the Medicare Resource Group. She has come and done presentations in person at the center. She's amazing. She's full wealth of information. And I've got to tell you, she's helped many, many members with the Medicare, with selecting either an Advantage plan, a secondary insurance, or even signing up if you just started Medicare, or even a prescription plan. Because what's happening, as there's so many different changes, 2021 is always, some insurances are raising up their prices, or, unfortunately, nothing is really lowering, but Caitlin will tell you more about it. But I just want to introduce you to Caitlin Steen. And we welcome you, and thank you, Caitlin, for coming on. Thank you.
Thank you, Selena. Thank you for having me. I just want to make sure everyone can hear me clearly. You'll have to excuse my internet is a little acting funny today. But yes, my name's Caitlin Steen. I work for a company called Medicare Resource Group. What we do is we educate seniors on Medicare, how to better navigate Medicare, knowing your rights to Medicare, finding, helping you assess your needs, financial or healthcare needs. We are a non-biased entity. We are licensed with every carrier in the state of New York. So we're really bound to the insured, which is you, and we're just here to help. So this seminar is going to just be the basics of Medicare, because, even if you're not changing your coverage or you're new to Medicare, it's good to know the foundation of Medicare, because it'll make it easier for you, the beneficiary, in navigating Medicare and better understanding it. Because as many of you know, it is the healthcare system in the U.S. is extremely confusing. So lucky for me, I'm a complicated person, and Medicare is extremely complicated. I'm going to explain it in a way that's easy for you to understand. I'm going to attempt to try. So this is my information. If you do need help with your Medicare, or you have a problem or a question, or you want to review something with your benefits, you could call me or email me at any time. I'm pretty, I'm always on call. Selena knows.
Yes. So, and I'm sorry, can I interject again? Caitlin, all of these services are free. There is no charge to you. So keep that in mind. Okay. Thank you.
Okay. So that's my information. But right now we're just going to talk about the basics of Medicare, because Medicare has so many moving parts, and Medicare is constantly changing every year. The laws change. And we're definitely going to talk about some of the changes for 2021. But we're going to talk about Medicare, the 4 parts of Medicare, which is probably the most confusing part of Medicare, which is parts A, B, C, D. There are many programs in New York Epic. And I also want to talk about being a senior in New York, because New York is the best place to be a senior on Medicare. New York has different laws than other states, and we're going to talk about that. There's a lot more protections for seniors in the state of New York. So again, what is Medicare? It's a federally sponsored program. It covers medically necessary surgeries, procedures, and services, your doctor visits. It requires co-pays, co-insurance, deductibles, and those payments are the responsibility of you, the beneficiary. So that is how Medicare works, federal program. It came out, I think, in the 1960s, and it's been evolving ever since then. So who's eligible for Medicare? If you're 65 or older and you have participated in the Social Security or railroad retirement system, or you're an employee of federal, state, or local governments, or if your spouse has participated, your legal spouse, you are entitled to Medicare. Individuals under age 65 that have been awarded Social Security or railroad retirement, after 24 months, you'd be eligible for Medicare. If you're disabled due to ALS or end-stage renal disease, you would be eligible for Medicare. Okay. So this is probably the most confusing part, the 4 parts of Medicare. And really there's 5 parts, I'm going to add one more to this, but Part A and B, all you need to know is Part A is hospital, skilled nursing, Part B is medical. This here is the federal, right? This is federal Medicare. That's the red, white, and blue card, okay? Part C and Part D are also part of the Medicare program, but they're private. These are administered by private insurance companies. I'm going to add one more here, MedSup or Medigap, which is also a part of Medicare as well, but it's also private, okay? But Part C, Part D, and Medicare Supplement they're administered by private insurance companies. Part A and B is original Medicare, okay? So this is what original Medicare by itself covers. Medicare Part A covers inpatient hospital, skilled nursing, hospice, home health care. It's not long-term care, but Medicare does cover some home health care, especially if you had a surgery, and you needed some assistance. It's short-term, it's not really long-term. Medicare Part B covers the following services generally at 80%, which is physician services, outpatient surgery, home health care too, believe it or not, and durable medical equipment. So these are the basics of what Medicare covers. Okay. These are the things that are not covered by original Medicare: outpatient prescription medications, routine dental care, routine vision care, hearing aids, foreign travel, cosmetic procedures and treatments, and long-term care. Medicare does not cover these things. And just, I make this joke, but it's actually, I'm being serious when I say it. You could be blind, deaf, and have no teeth. Medicare does not care. They're not going to cover it. So this is just one example why people do usually get some type of supplemental coverage, because Medicare is limited in what it covers. It really, at its core, Medicare covers preventative and medically necessary services. Okay, so what does original Medicare cost? So for Part A, which is hospital, that's most people are not going to pay a premium. If you've worked 10 years, which is equal to 40 quarters, you or your legal spouse, you're going to pay, your Part A is going to be free. When you turn 65, you're going to just age into Medicare Part A. A lot of people just get a card, it will say just Medicare Part A, if they're still working and have employer coverage. But most people who paid into the system are not going to pay a premium. If you did not, if you worked 40 quarters or less and you're a US citizen, you're entitled to Medicare, but you're going to be subject to a premium. You're going to pay, and if I recall, I think Medicare Part A is well over $400 per month. So it's good to know these things, because Medicare, if you didn't pay into the system, Medicare is not cheap. Okay. So for 2021, this is what most people, most people on Medicare are going to pay this for their Part B premium. And Part B, again, is for your medical services. You're going to be paying $148.50 per month for your Medicare Part B. But if you're single and your income is more than $87,000, or if you're married and your income is more than $174,000, you're going to pay more for your monthly premium. Social Security, they will adjust it because you're higher income. You're in a higher income bracket. And usually the Part B premium is deducted from your Social Security check. However, some people may still be working, they may be self-employed. Some people want to opt out of, they don't want to collect Social Security till they're 67. I see that happening more and more. You can have it set up with Social Security or you would actually just call Medicare, and they could do an EFT where the Part B premium is deducted from your checking account. So you have to set it up with them, but you can do that if you're not going to be collecting Social Security, if you're going to collect it later on. So just to take note. So this is just a new card. If you haven't, they changed it about 2 years ago, but originally it used to be your Social Security number would be on there. which I thought was a silly idea. And I'm glad that they finally corrected this, because the amount of fraud that was occurring was, identities being stolen, so it's much more secure now. It's an 11-digit number. If you ever, I just want to really make this clear, because this has been happening since COVID. I've had quite a few people from RSS call me, as well as my own clients, saying they're getting Medicare and Social Security calling their house, asking them questions, saying they're eligible for some type of program. First of all, Social Security doesn't call your house. And secondly, they ask anything for your Social Security number over the phone, you better believe it's fraud. If a company says that they're a plan and they ask for your Social Security number to enroll into a new Medicare plan, that is fraud. They do not ask for that information. A legitimate company will not ask for that information. Okay, so remember, it's your 11. This is the new number. Should be 11-digit number. Okay. So again, it's automatic. So if you're 65 and you're collecting Social Security, your enrollment into Medicare Part A and Part B will be automatic. However, some people decide to, wait later on. They have employer-sponsored coverage and they're working. So you have the option to decline Part B coverage. You can do that. You can opt out. However, just take note that you better have creditable coverage through your employer. So if there's, and we're going to go over it more, but if there's 20 or more employees in that company, it's deemed creditable coverage by Medicare. If there's 20 employees or less, it's not creditable, and you could possibly deal with a penalty when you enroll later on. Okay, but normally this is how Medicare works. So if my birthday is May 5th, my Medicare would start May 1st. However, if my birthday is May 1st, my Medicare start date would be April 1st. I don't know why that is, but that's how Medicare does it. Again, if it's not automatic, which more and more people are working later on, people are not retiring at 65 per se. A lot of people want to work later on. If it's not automatic, you can actually complete an enrollment online at ssa.gov. You could also call 1-800-772-1213. You can also look up your local Social Security office. They'll have a local phone number, and you could actually, have them set it up for you as well. If you're past 65, make sure you have all documentation that shows you've had creditable health coverage. It's very important. I can't stress that enough. But since COVID, you can do a lot more online and through the phone now. So I recommend, if you are new to Medicare, I would call up your local Social Security office. They can now do a lot over the phone through fax and mail, and they've been better. They've been definitely doing a lot better. So this is the initial enrollment period. If you're 65, okay, you have 3 months before you turn 65 to sign up, or the month you turn 65, or 3 months after. So 313. This is called the initial enrollment period. That's when you're turning 65. You're new to Medicare. The effective date of coverage will depend on when the enrollment occurs. But most people normally, if you're going to be on Medicare at 65, people, they enroll, will call up Medicare, sign up for Social Security, and get the ball rolling, usually right around this time, okay? But once you sign up, you're collecting Social Security, your Medicare is going to be automatic. Okay? This is called the general enrollment period. So if you missed your initial enrollment period, which is when you turn 65, you can every year from the month of January 1st to March 31st, you can sign up for Medicare. During this time, though, your effective date wouldn't be till July 1st. So your Medicare would not be effective till July 1st, even though you're signing up in the months of January or February. Again, I can't stress this enough. If you do not have creditable coverage, when initially eligible, you decided to not enroll in Medicare Part B when initially eligible, it could result in a 10% premium penalty for one's lifetime per 12-month period not enrolled, and you are stuck in this penalty. You cannot get out of it. I do have some clients who have to pay like $900 a year in Part B penalties because they did not sign up for Part B because they thought it was optional. And I don't know, I know some of you probably have the Medicare and You guide, and it's like reading a different language. It's Medicare Part B is not optional. It is only optional if you have creditable health coverage. For everyone else, if you don't have creditable health coverage, it's basically mandatory at this point. Okay. But again, if you're past 65 and you have creditable health coverage and you show that documentation, it will be waived because you are showing that you had creditable coverage. There's also something called special enrollment periods. So if you're working and you do have creditable coverage and you're retiring or you have loss of employer coverage, you would be granted a special enrollment period by Medicare to sign up for Part B, okay? And just take note, if you're 65 and older, that employer must have 20 or more employees for that coverage to be creditable. If you're younger and you're on Social Security disability, that employee must have 100 or more employees for that coverage to be creditable. So the guidelines are different, but okay. Again, it's good to sign up. If you're going to lose your employer coverage and you're past the age of 65, you want to sign up as soon as you possibly can. Because the sooner you enroll in Part B, the sooner your coverage will begin. It also triggers, which in New York, I'm going to talk about this now. This is general. So if you enroll in Part B, it triggers your 6-month Medigap open enrollment period. New York State, it really doesn't apply because we have different laws in this state. So for other states, Medicare supplement plans are usually, they're medically underwritten. So after 65, if you try to sign up for a Medicare supplement in like the state of Pennsylvania and you have a health problem, they will deny you enrollment into that plan. Or they'll, have pre-existing condition clauses, meaning they won't cover your health condition. New York's very different. New York has a lot of protections for seniors. So in this state, Medicare supplement plans are guaranteed issue, even past the age of 65. They are community rated. There is no medical underwriting. The only time there could be a 6-month waiting period in a Medicare supplement plan in the state of New York is if you had a 63-day gap in your health coverage. Only then would they give you a waiting period. But for the most part, you can enroll in a supplement at any time. The premiums are very high in New York, but there is no medical underwriting. So you do have more protections in the state of New York, which I can't stress enough is a very good thing if you're a senior living in this state. Okay. You also have 63 days from the Part B effective date to enroll in a Part D plan without a penalty. So in addition to getting a possible penalty for Part B, if you don't have creditable coverage, you could also be facing a Part D penalty, which is the drug coverage, if you don't enroll past that 6. So if you wait to enroll in a drug plan, how it works is Medicare looks at every month that you did not enroll in a standalone prescription plan or have creditable prescription coverage. Every month that you didn't enroll, they multiply that by the premium average in the United States. So I think the premium average goes up every single year, but the premium average, let's say it is $32.10 per month is premium average for a drug plan in the United States. They times that by 1%. So let's say it's 32 cents, right? 32 cents times the amount of months that you did not enroll into a drug plan or have creditable drug coverage, that will be your penalty every month for the rest of your life. I have a woman who did not enroll because she's very big into holistic medicine. So she saw no reason to enroll in Part B because she thought it was optional. She doesn't take drugs, so she did not understand why she needed a drug plan. And she's 75, and so this is 10 years of penalties. And she finally developed a health condition and had to, take a medication that happens to be very expensive. So she, wanted to look at drug plans. And guess what? She's paying about $80 a month or maybe a little bit less, but around that price point in just Part B penalties, not even factoring in Part B penalties. So it's very important to make sure that your coverage is creditable. And if it's not, you want to get in a drug plan or have some supplemental coverage as soon as possible. But most important, you want to make sure that you have your Part B and your Part D. So are there any questions? Or I'll just keep moving along if there's no questions.
You're welcome to unmute yourself if you have any questions, or anybody who is on the phone, *6 if you have any questions.
Hello, can you hear me?
Luciana, yes. Hi, Luciana.
Hi. Yeah, about the medication, but now that my husband is no longer here, and my daughter bought, she knows better than me. She had to get maybe she can explain it better, because I want to make sure that, I'm covered with that. Because Alina, can you please, I'm sorry if I take it. Alina, what about the medication? Did you hear what they said? They charge you if you're not enrolled in a medication plan.
You have a separate medication plan, I got you.
I have a separate?
Medication plan.
My daughter
You
said,
you have a drug plan. You have a standalone prescription drug plan.
I have a
Yes.
yeah.
Okay,
Yeah.
then you're fine. You're
Oh.
fine.
No, I want to make sure because, yeah. Okay, and I guess that's all. I'm sorry to take so much time. Thank you.
No problem. No problem. It's good to always make sure. Nothing wrong with that.
Yes, yeah.
Okay. So these are the options to supplement your original Medicare Part A and Part B, which is the red, white, and blue card. Again, Part B only pays 80% of your services, okay? And there is no out-of-pocket maximum for Medicare, meaning let's say you have $20,000 in medical bills under original Medicare, you would be subject to pay that. So people find options to supplement the gaps that original Medicare does not cover. Okay, so some people may just have original Medicare only with a drug plan. However, they're leaving themselves vulnerable. Some people get Medicare Advantage plans or they get Medigap plans. And we're going to talk about the differences because that's probably one of the most confusing parts of Medicare is what are the differences between a Medicare Advantage plan and a Medigap plan. Okay. And just note that Medicare Advantage plans have the drug coverage built into it. Most of them do. Okay. So this is what you would pay in 2020. This is going up. I do have the amounts. I have to update it, but this is what you would pay right now in 2020 under original Medicare. If you went into a hospital, you would pay $1,408 if you walked into that hospital. If you went into the doctor's office, you would pay $198. First time you go into a doctor's office under original Medicare before Part B would begin paying 80%. Okay, and you, the beneficiary, are responsible for 20%. But take note of this: doctors are allowed to, by Medicare law, they're allowed to bill 15% more than the Medicare approved amount. It's called, if you have a Medigap plan, you'll know it. You'll see it on your application or your benefits. It'll say something called excess charges. So when a doctor bills 15% more than the Medicare approved amount, it's called a Part B excess charge. So essentially under original Medicare, you, the beneficiary, could actually be responsible for 35% if you're going into a doctor's office and getting an outpatient surgery. And again, there's no limit for how many Part A deductibles or 20% cost share. There's no cap on it. So there's a reason why people do get some type of supplemental coverage for that exact reason, okay? So again, this is what you would pay.
I'm sorry. I think Brenda, I have a question. Could you unmute?
Sure.
Brenda, you're still on mute. Make sure you unmute yourself.
Okay, I'm unmuted.
There
My
we go.
question is, hi, For hospitalization, the deductible on original Medicare is $1,408 for 2020. If you go into the hospital, does your secondary help you with the deductible?
So if you have a supplement plan, depending on which one it is, because
Yes.
they all vary, Plan N covers the deductible, Plan G covers it. I think Supplement Plan A doesn't, or it only covers some of it. Plan K doesn't cover it at all. Plan L covers half of it. So it depends on the supplement plan you have. Some supplement plans cover the whole entire Part A deductible. Some cover half of it. So or some don't cover it at all. So it depends on your.
Okay. I would, because I was just in the hospital and I'm waiting for all these bills to come up and I want to know what, now I know that I have to wait to see what my secondary will cover. Hopefully it will cover all of it.
Yeah. Do you know what you currently have? What is it?
Yes, I do. I have GHI CBP.
Oh, that's about, you have group health insurance.
I have what?
You have group health insurance. It's a retiree plan, right?
Right, exactly.
Okay. Yeah, usually even those work pretty good, just like they work as well as supplements do usually. So I would expect if you do get any bills, they're not going to be that high. Yeah. Keep your GHI. Keep it.
Good. Thank you.
You're
Thank you.
welcome.
I can't hear it.
Oh, can you hear
She's
me now?
saying-
Yeah.
I said, keep the GHI. Don't switch it to a supplement or an advantage plan.
No, I'm not. I'm staying with this, but I figured I'd come in just for the knowledge.
Oh, it's absolutely, knowledge is power.
Right. All right. Thank you very much.
You're welcome.
That's it. I'll mute myself again, okay?
Okay.
Thank you.
Okay, so this is what you would pay under Part A, all right? This is each benefit period.
Caitlin, can you speak a little louder? I'm sorry.
Sure.
I can't mute myself.
I'll do
Oh,
it.
that's why I'm getting.
I just
okay.
did it. It's
All
okay.
right, that's why it's a little bounce back. Okay, so this is what you would pay under Part A, okay? And then, oh, that's all right. Let me go back. So this is what you would pay under Part A. You also get something in Medicare. This is just original Medicare, though. You get something called 60 lifetime reserve days. So under original Medicare, this is what you would pay. And then days 61 through 90, you would pay $352 per day. Okay. After days 150, you would pay all costs. This is a benefit period. So each benefit period would restart. After day 60, a new benefit period would start, unless if you wanted to use your lifetime reserve days. Most people don't, but you know, this is how original Medicare works by itself. Okay. Skilled nursing care is a big thing too. That's probably the biggest thing people get. The reason people get a supplement plan or they get some type of supplemental coverage is because original Medicare really doesn't covers really only 20 days of skilled nursing. That's it. At $0 a day. After that, you start paying a very high cost. So I'm going to talk about that in the next slide, but this is the conditions and requirements for skilled nursing care. It is obviously just technically a rehab facility. So if you get a double knee replacement or hip surgery and you need time to recover and rehabilitate, that's what a skilled nursing facility is. It must be Medicare participating. If it isn't, you would be responsible for the full cost. So make sure that it is a Medicare participating skilled nursing facility. These are just the guidelines. Generally, to be accepted or admitted into a skilled nursing facility, it has to be within 30 days of leaving the hospital, okay? And it must be for a hospital-treated condition. So again, this is why people get some type of supplemental coverage. This is what you would pay under original Medicare. You would pay $0 days 1 through 20, but then days 21 through 100, you would have to pay $184 per day. And there is a very good chance you may need, depending on your surgery, you might need more than 20 days in a skilled nursing facility. I mean, I have many clients who spend a month or two in a skilled nursing facility. So there's a lot of reasons why people do get some type of supplemental coverage. Okay. Okay, Part B again, doctor services, outpatient clinical lab tests, durable medical equipment. This is what Part B covers. Medicare loves covering preventative services, okay? But this is what Medicare Part B covers. So again, Part A is hospital. Remember, Part A is always the more catastrophic. Part A is hospital, hospice, inpatient, skilled nursing. Part B is outpatient, doctor services, outpatient surgery. Okay. So this is what preventative care is covered under Medicare, okay? And generally, just you can take note of this, more and more Medicare, the Advantage plans they're starting to reward people. I see some new plans now. They want you to go to your yearly wellness visit. So they really strongly encourage preventative care. But just know, especially with colonoscopies, we run into this a lot. A colonoscopy, preventative care generally is $0 under Medicare, as long as they don't find anything. So if you go in for a colonoscopy and they don't find anything, you're probably going to be paying $0 because it's, they didn't find anything. But the minute they find polyps and they have to remove those polyps and now they have to diagnose what it is no longer preventative. It's going to fall under outpatient surgery. And you're probably going to be subject to, depending on your plan, if it's an Advantage plan, you're probably going to be paying an outpatient surgery copayment or deductible, depending on what plan it is. So just keep note, it's only fine preventative if they don't find anything. If it's no longer, if they find something, it's now diagnostic. It's not preventative anymore because now they found something. So, any questions? Okay. So again, these are some of the options. Medigap plans, which I was talking about earlier. New York has some very different laws when it comes to Medicare supplement plans, which is actually a very good thing because it protects you, the beneficiary. They can't deny you enrollment into a plan because of your health condition in this state. However, if you were in another state, it's a different story after age 65. They can deny you. So it's very good to be in this state. Because what a lot of people will do in New York is they'll enroll in an Advantage plan at 65, and then as their health may deteriorate over time, they'll then go into a supplement plan. And I'm going to talk about the key differences between supplement plans and Advantage plans, okay? But again, you must have Medicare Part A and B in order to be in a supplement plan. You also it's illegal, and keep note of this, you cannot have in the state of New York or in the country for that matter, you cannot have a Medicare supplement and a Medicare Advantage plan at the same time. It is illegal. What will happen is if you do that and you have a catastrophic occurrence where you go into a hospital, neither plans will pay for your services. You'll actually end up being stuck with all costs. So because it is illegal, they'll consider it invalid. They won't honor it, okay? But Medigap is different. Medigap helps cover that 20% that original Medicare does not pay for, and some of them even cover the excess charges. Some will cover the Part A deductibles. So that's what Medigap is. It's like a secondary policy. Under Medigap, your red, white, and blue card stays as the primary. So if you have a billing problem, you deal directly with Medicare because they're the primary insurer. And your supplement is secondary. It's only just covering those gaps. They're designated by letter codes. So a Plan F on AARP is no different than a Plan F on Blue Cross Blue Shield. The only thing that will vary is the premiums, but these are standardized in the United States. So for Medicare supplement plans, no matter what carrier it is, Plan A is a Plan A, Plan B is a Plan B, okay? And don't confuse Plan C with Part C. It's just another supplement plan. Okay, Part C is different. All right, which we're going to talk about. Let me just go back real quick. I'm getting ahead of myself. Okay, but they cover a basic group of benefits. They generally don't have drug coverage. So you have to get a standalone drug plan with a Medigap plan, or you may have some type of employer retirement drug plan. But they generally they don't offer dental or vision. They just work as a secondary with original Medicare. That's how they work. You have no network of doctors. As long as the doctor accepts original Medicare, they are required to accept your supplement. Okay. So now I'm going to go to Part C. Could anyone tell me fundamentally in very simplest terms, what is the difference between a Medicare Advantage plan, also known as Part C, and a Medicare supplement? What is the main difference between the two? Does anyone know? Someone know? Okay, this is probably the biggest, and this is probably what gets most people confused between a Medicare Advantage plan and a Medicare supplement. Because what are the differences? They are both offered by private insurance companies, yes, but what's different is, in this scenario, if you have a Medicare Advantage plan, okay, essentially the private insurer is almost acting as a primary, okay? So in this situation, if you have a billing dispute, or you need a claims, or you need something approved or authorized, you're dealing with the private insurance company in this scenario. Under Medicare Advantage plan, the private insurance company controls and administers your Medicare Part A and B benefits. You must have Medicare Part A and B. It's not that you're not part of the Medicare program anymore. You're still part of Medicare. It's just that you now have a private insurance company controlling and administering your Medicare Part A and B benefits. So that's the difference. You generally have to use a network of doctors and hospitals on an Advantage plan. The plans can vary from county to county. Generally, Advantage plans are affordable. A lot of the time they're $0 in premium or very low in premium. They'll have the drug coverage built into them. A lot of them now have dental, vision, transportation, acupuncture. I mean, there's a lot of different benefits now with them. But generally, the fundamental difference between the Medigap plans and Medicare Advantage plans is, yeah, you're going to have low premiums, but you're going to have co-payments. So you're going to have a co-payment when you go to see your doctors. You're going to have co-payments or co-insurance if you get an outpatient surgery, if you go to the hospital. But essentially, what a Medicare Advantage plan acts is, it's almost like you're taking the insurance company's name and slapping it onto your Medicare card, your Part A and B card, because they're controlling your benefits. But what protects you with a Medicare Advantage plan is it has a maximum out of pocket. So for most Medicare Advantage plans for 2020, the maximum out of pocket was $6,700 for healthcare costs. And what that means is, if you hit in that calendar year, your doctor visits get counted towards it, all your deductibles, co-insurance gets counted towards it, co-payments for healthcare only gets counted towards that $6,700. If you reach that amount out of your pocket, the plan would then pay 100% of your medical bills for the remainder of the calendar year. Generally, a good Medicare supplement plan, like a Plan G or a high-end supplement plan, won't have any out-of-pocket costs. But on those plans, people are paying quite a few $100s a month. So really the difference is this: Medicare supplement, you're paying now, so you don't have to pay later. Medicare Advantage, you're not paying now, but at some point you're going to pay later. So that's really the fundamental difference between the two, okay? There's many different types of Medicare Advantage plans. They've come a very long way from even like 5 or 6 years ago. The most common is the HMO, Health Maintenance Organization. And traditionally, when we think of an HMO, we think of, I have to schlep to my primary doctor to get a referral to see a specialist. That has changed a lot. I would say many of the Advantage plans today, I would say more than half of the Advantage plans that are offered in the Bronx today are open access HMOs, which means you no longer need referrals, but you need to use a provider that's in network. So there's many of those today, and that's a very good thing. There's also something called an HMO point of service, which is you are required mainly to use a network of doctors, but in certain situations, you can go out of service, out of network. And that would be like, for instance, if you needed a second opinion, if you, let's say, God forbid, had breast cancer and you wanted to get a second opinion from a different doctor, that would be, you could go out of network in an HMO point of service. But mainly, you're going to stay in network. There's also something called a preferred provider organization, which is you could go in or out of network. You do not need referrals. There's even PPOs now preferred provider organizations that are nationwide networks in the United States, where you could use doctors in Florida, New York. They've come a long way with the preferred provider organizations. Just know if you're going out of network on a PPO, there's no guarantee that the doctor is going to accept you as out of network. It's really up to the provider or a doctor if they want to accept the terms and conditions of your plan. They could say, I don't want to accept you, or they have that choice. There's also something called a special needs plan. So in the Bronx, you know, some people, if you're on Medicare, you may qualify for extra help. You may qualify for Medicaid as well. In that situation, there's something called Medicare Advantage dual special needs plans. And what they are is they're Medicare Advantage plans that coordinate your Medicaid benefits from the state and your Medicare benefits from the federal government. And they generally have a lot of benefits. A lot of them have very $0 co-payments on many different services. So, yep, there's also something called a chronic special needs plan, not really available in Bronx or New York, but they're for people who have a specific health condition. Let's say I have a COPD, for instance. There are plans that will be tailored to my health condition. They're called CSNPs, chronic special needs plans. But those are the two types that are most common. There's also something called a private fee-for-service plan, which is generally, there is no network of doctors whatsoever. But when you do use a private fee-for-service Medicare Advantage plan, again, you're going to a doctor and it's the same situation as if you were going out of network on a PPO. On a private fee-for-service plan, the doctor has the right to accept or deny the terms and conditions of the plan, so to receive payments. So either it's the doctor's choice if they want to accept you or deny you. And there's something also called a Medicare medical savings account. It's not really common here, but it's basically a Medicare Advantage plan that has a savings account in it, built into the plan where you could use towards co-payments, deductibles. You might see there's one in the Bronx. I think it's something called like a flex account, where there's a couple $100s in the account and you, the beneficiary, can put it towards co-payments. But again, not really common in the Bronx or New York for that matter. Okay. When and how can you enroll in a Medicare Advantage plan? Generally during your initial enrollment period. So if you're 65, or during the yearly open enrollment period. So from October 15th till December 7th, we are in that period now. So if you need to review your coverage, you can also change your drug coverage. If you're on a standalone drug plan, you can also, if you want to look at your supplement, this is the time to make those changes. You could actually make as many changes as you want during the annual enrollment period. Whatever application you sign last is what will be effective for January 1st, 2021, okay? You also may be able to join at other times based on a special enrollment period. So if you move out of the county or you move out of the state, if you qualify for extra help like Medicaid, those would qualify for something called the special enrollment period. And I just want to talk about the two big changes for 2021 for Medicare Advantage and Part D. So for Medicare Advantage, if you had end-stage renal disease, you were not allowed to enroll into a Medicare Advantage plan. That was always the law. They changed that for 2021. If you have end-stage renal disease, you can now enroll in a Medicare Advantage plan. They also changed something else. So for certain diabetic insulins, specifically, I think Novolog, Humalog, I think there might be a few others, those insulins were costing Medicare recipients quite a fortune. There's a program now, and some carriers are part of it, where the beneficiary will pay at most for that insulin $45 per month, and they have no deductible. So the insulin, it's an insulin savings program. That is a big, big change for 2021. Something I want you to know, though, is it's a great savings for people on insulin, but I recommend if you're not on insulin, or even if you are, everyone should just check their drugs for 2021. I was saying to Selena, I noticed that certain drugs, you know, I don't know if it's the insurers balancing out their expenses or, you know, counteracting some of the costs and savings, but every year drug prices do change, and it's good to review your drug coverage just to make sure. Because we did notice that some drugs were going up in price that were non-insulin drugs. And so please just review that. It's always good to check. Okay. Any questions?
May I ask some questions or emphasize some things that you brought up, and it's been very informative. I want to emphasize to the members here that going into the hospital, if you go into the emergency room you have to be admitted in at least 3 consecutive days in the hospital. It should not be stating that you're just being observed, because you're going to be billed incorrectly. Caitlin, do you want to talk about that? And then if they have to go to
hospital observation?
Yeah, hospital observation. Remember? So
no, hospital observation has will have a co-payment if you're being observed. Then if you get admitted inpatient, then that's different. You're going to be subject to depending on your plan, you would have a deductible. Or some plans have a day 1 through 5, you have to pay a co-payment, or if you're under Part A. But until you're admitted inpatient, you would pay the outpatient hospital observation cost. Depending it could be like a couple $100 depending on what plan it is. But that's, hospital observation is usually will just be like a flat, you'll have to just pay like a flat rate depending on what the plan is.
Because what's scary and that I've heard of is that people go into the hospital, you're signing all these papers, you're a little confused. And what happens is you sign a paper saying you're just being observed. And they don't, and it could be, you could be in there for 3 days and you're just being observed. And then they may send you to rehab. You're responsible for all that amount of money for rehab, right, Caitlin?
So if they send you to skilled nursing, you would be responsible for days 1 through 20, you would pay, because as long as if you're out of the hospital, it says a hospital related, you would pay $0 days 1 through 20 in that skilled nursing or rehab facility. But make no mistake, after day 20, you're killed. You're going to get killed. You're going to get killed. And as long as it's a medical condition, so let's say they had you in, if they had you in hospital observation for like a broken leg, I would think that they would put you inpatient, or like, let's say you broke your hip, a hip fracture. That would be an inpatient hospital. You might just pay, you probably would pay days 1 through 3 in that situation. It really depends, because what factors in is like the billing codes and what the situation is. If I just go in there and I have, I'm having panic attacks, but I think I'm having a heart attack, and they run all these tests on me and I'm staying in the hospital a couple days and they're observing me, that's kind of like a hospital observation scenario. But if I have, a situation where I fall and break my hip, and then they put, that would be, so it really depends on what the situation is and how they bill you. Because you're right, you do sign a lot of forms and you may not know, they may just say day 1 they're observing you, and then they admit you in the second day. But it really comes down to the billing codes and what your rights are. And it's really good for people to know what the evidence of coverage is on their plan, because I can't tell you how many times there's a billing error and it's not the fault of the carrier, but it's actually the fault of the billing department, where they misbill you or they bill you incorrectly because they didn't code something properly. There's like probably hundreds of thousands of codes for each condition, or each MRIs probably have about 200 different codes for my doing an MRI on my abdomen as opposed to my head. It's crazy.
Right.
Ridiculous.
So basically, for me, for bottom line, from what I hear from members, if you wind up in the hospital in the emergency room and you think you're probably going to have to go to rehab, please stay in the hospital for at least 3 days. Make sure it's not under observation, that you're in the hospital. So then you'll be billed correct, or you won't pay as much money. So
you're absolutely right. You could get hit with like expenses, and if they're running tests on you, you could get hit with those costs too. Like I tell people, if you're on a Medicare Advantage plan and you're in the hospital for like a week, you better believe and prepare yourself that you're probably gonna possibly hit your maximum out of pocket, or you're gonna hit close enough to it, you know?
Okay, I'm sorry. We have like a couple more minutes because we do have to move on.
Okay.
We
All
have
right.
another
Questions
session.
from
members or?
Yep.
Okay.
All right, go ahead. We have also recorded this, so if anyone wants the recording, and obviously we'll share it with other people who didn't
Okay,
attend as
so
well.
how many more minutes do I have left?
Like almost really none. So we really need to wrap it up.
All right. So Caitlin, this was, I know it's a lot of information. Thank you so much. It was excellent. If anybody has any questions or needs Caitlin's help, please contact me or contact the senior center, and I'll be able to connect you all. But I know it's a lot of information. I hope you learned a lot from it. So
yeah, I mean, like I said, I could probably spend another hour on it. But if there's something that I missed, or you want me to, if you have a question, please take down my information. I'm more than happy to talk about anything in more depth, or if you need your coverage reviewed or any questions, please feel free to call me or email me. My number is 347-518-2902, and that is my email below.
Okay, Caitlin, if you can also send us the PowerPoint, that would be great, because it looked like there were a couple slides that you didn't get to.
Couldn't get
obviously, between you and Selena,
yes,
certainly would love to have you come back again and maybe answer some more questions. I'm sorry, I just
thank you. We have another program, so thank you all
thank
for
you
attending.
so much, ladies. Thank you.
Thank you, Caitlin.
Bye.
Excellent.
Have a good one.
Thank you.
Bye-bye.
Bye-bye.